I live from Marina Valley, and I met Dr. Torkian about 3 years ago, and I have seen 15 doctors since I met him, and they all turned me away. I have 2 revision surgery from my first one, so altogether it will be like 3. And I was kind of afraid to have somebody else to do it, but I did give Dr. Torkian a chance to do it, and I knew I can trust him, and I'm so glad that I did, because he's a great person to talk to, really easy to talk to, and he understands what I'm coming from. Come on in. Hi, Doc.
Hi, Maria. How are you?
How are you?
Good
to see
you. You're looking good. How do you feel?
I feel very good.
Good. No breathing problems since the last time I saw you?
No, that's ever since when you did the surgery. That was like, what, 3-4 years ago?
Yes. Very
and
good.
I'm so glad that I let you do that, because now I have no problem breathing.
Good.
And my self-esteem is actually up.
Good. I haven't seen you cry for a while since you've been
Yes, definitely.
We used to cry every time we were here.
Every time I see you, you make me cry, but that's our thing now.
Let's review your pre and post-op pictures.
Okay.
Okay, we're going to kind of go back and take a look at what we've done and see if there's anything else we can do to optimize your results.
Yes, definitely.
Good. What happened when I first met Maria was that she was approximately 2 or 3 months out from a secondary procedure to try to improve the scarring that we see in this area. The scarring in the left nostril was apparently from the internal part of an open incision technique, or an open rhinoplasty technique. The internal incision in here, where you see this slight redness inside of the nostril right in there, is basically representative of a scar that had contracted and grown in a wound that probably had not healed properly. In this area you can see that there is a apparent over-resection or over-reduction of the left nostril, and therefore there's a complete lack of symmetry in the nostril base as well. Whereas the groove between this nostril and cheek, or alar cheek junction, is about here, this alar cheek junction is about 3 or 4 millimeters in from that. So after making the proper measurements for her, the procedure to correct her deformity that we see here was basically aimed at widening the base of the nostril on this side, removing this scar over here and replacing it with healthy tissue that could also provide structure and proper healing in that area. And for that I used what we call a conchal composite graft, or ear composite graft. A composite graft in her case is basically a concave piece of tissue from the ear skin that includes an undersurface layer of cartilage and an outer layer of skin. And those 2 components can not only replace the tissue inside of the nostril that would be removed when the scar was removed, but also provide the structure that she needs to keep it from recontracturing or scarring and closing back up again the way that it has the first time. In this picture we see a planning picture that I used before surgery in order to try to find the optimal position of her nostril cheek junction. As you can see here, the resection that was done previously had left her with an altered nostril cheek junction that had left this area a little bit narrower than the other side. So in this picture I have markings that were made with calipers and drawings that were made with precise measurement in order to measure exactly where her nostril should be. Based on this picture, I was able to get the nostril out by approximately 3 millimeters to the point where that arrow is right there. And as you can see here, the scarring looks even worse in this position, but this scar had to be removed in order to allow the movement and also open up the nostril like it should be, so that she can have good function of her nasal airway. Now when we look at the pre and post-op pictures with Maria, we can really see what an effect this has really had on her nasal airway, both the airway and the symmetry of her nose. As you can see, again, this is the preoperative one here, where we have the base of the nostril, which is way too medialized, or a little bit too far inward, and some scarring in the left nostril corner. And here it is afterwards. Now, we had a couple of minor touch-ups that we had to perform on her nose because of some scarring and some things that had happened inside underneath the skin. But we've been able to get this basically as symmetric as is possible at this point. On this side and here you can see this is the junction between the ear cartilage graft and her natural skin. And there's still some scarring, so she does have some difficulty with scarring, And we've had to battle that with steroid injections here and there. Although the steroid injections did hurt her initially, she has gotten used to them, and she does get a good result from them each time we have to do them. So Maria, let's take a look at your nose now, see how everything's looking. I'm going to just take a brief look inside the nostril here.
Okay.
Looking on this side. Now we do have a little bit of scar there still from where our cartilage graft has healed. But even with that scar, the symmetry is much improved, and I would say we're almost symmetric now. I don't think we even need to do any more of the steroid injections. And you've healed really nicely over here too. I'm just feeling here to make sure that everything is nice and strong and we won't have any further collapses in the future. It's looking very good. Now you remember what you looked like before.
Well, actually I did forgot because I seen the better look now. Now when looking at the pictures and I said, oh my God.
It's hard to remember.
It's hard to remember because you try and kind of forget about that.
But it's good because you're able to put it behind you.
Definitely.
I'm glad to see that. When I first met Maria, she was in tears from the moment that we spoke about her nose. The asymmetry, the lack of form, and the ability to breathe through her left side was completely gone. So in the initial stages it was very difficult for her because she had a result that really she couldn't live with, and from a public perspective she was unable to go outdoors, she was unable to really go back to her normal function at work as well. After a short waiting period because of some swelling and some scar contracture that I knew was going to resolve and improve during the waiting period from her secondary operation with her first surgeon, we came back and we planned the operation for her in a second consultation. And using a series of grafting from the ear as well as flaps from the cheek, we were able to reconstruct the entire left nostril and open up the nostril, restoring symmetry and function of the nostril both.
I'm so glad that I came back with Dr. Torkian, and I gave him a chance to prove it to me that I can trust him, and I'm glad I did because I don't remember what I looked like about a few years ago before I met Dr. Torkian, because I'm trying to put that behind me. I was miserable, I couldn't breathe, I have a hard time, like I said, I'm having a hard time breathing. My nose collapsed. I had a really, symmetric is really difficult. My self-esteem are very low. And gave Dr. Torkian to work on my nose, and now I look great and I'm happy. I love Dr. Torkian, so I won't trust anybody else.